Let's talk about how two specialty areas, marriage and family therapy and behavioral analysis, has dealt with the challenges of COVID-19 and providing services virtually. And to discuss this, I'm really glad to have with us Dr. Janessa Dominguez. She is the founder and CEO of Shaping Change. She is a board certified behavior analyst, a licensed marriage and family therapist, a qualified behavior analyst, and a licensed mental health counselor. Dr. Dominguez is an American Association for Marriage and Family Therapy clinical fellow, and she serves on the board of directors and leadership for the American Family Therapy Academy, otherwise known as AFTA. So, Dr. Dominguez, thanks a lot for being with me today.
Thank you for having me.
Yeah, so I'm really interested in maybe we could just start with if you can tell us a little bit about the work that you do, and then it would be so helpful to hear about the challenges of doing marriage and family therapy and behavioral analysis virtually, and what that looked like for you. But if you can just start by telling us a little bit about the work that you do.
Yeah, so I am the owner of Shaping Change, and we specialize in what's called applied behavior analysis. And applied behavior analysis is a different type of therapy than what you might be used to with your typical psychotherapy, where we are really a hands-on type of therapy where we're looking to teach new skills while we're also addressing some of the challenging behaviors that some of the patients that we might be seeing might have. And we do this by teaching in ways that the individuals that we're working with are able to learn. So if that means that we need to be presenting what we call visual cards, where it might say the instruction or have a cue as to what that instruction might be, we're using that. If we're teaching different types of coping mechanisms or different ways of communicating that work best for those that we're working with, we're looking to put all of that together into our treatment plan so that those that we serve can learn those skills. And a lot of times when we see an increase in those skills, we see a lot of reduction in some of those more challenging behaviors. We also, oh, go ahead.
Yeah. So focusing on that, applied behavioral analyst, with the clients that you work with and the families and the techniques that you use, in terms of doing that work virtually, what are the challenges that you've seen?
So I've seen both. So in our experience over these last couple of years where telehealth really became a huge option, what we noticed is that it really broke down a lot of barriers. So we were able to serve patients that without telehealth, we otherwise may have not been able to continue seeing. They may have not been able to continue to access services. So that was a really big plus. But at the same time, we're working with a population that has difficulty with attention, that often has difficulty sitting and staying still. And we also work with a younger population a lot of times. And kids already can be wiggly and have a hard time sitting in front of a screen. And so those were some of the challenges that while we were doing our sessions, we often needed someone else, like a caregiver, to be present to assist with the session. And that can add a lot of challenges to the family when we're looking at doing telehealth. But I think that the positives to being able to access services really outweighs some of those challenges that we noticed.
Yeah, and so sounds like part of it is just the limitations of the current technology. We're currently doing video sessions anyway, and having the visuals is important for the work that you do with behavioral analysis, right?
Mm-hmm. And materials. And that's
and
really
materials.
hard when we have things to set up and we're across the screen. Mm-hmm.
Yeah. So I can see, hopefully technology will evolve where it's not where you have to be sitting stationary, but the technology, the video conferencing technology moves around with you. Um,
Hmm.
and so I've heard some clinicians where they would have a caregiver hold like a smartphone with the camera and just
Hmm.
go around with the child and be the kind of videographer for the
Hmm.
for the therapist. Have you all done any of that, or how does that work?
Um, I think it's really specific to each patient that we're working with and kind of how we set it up and what we're doing. So I think that if the possibility is there and it enhances the session, it's definitely something that can be done.
Yeah, and I've heard people using more than one camera too. So they might have, the monitor where the client can see you, and they have the camera there, but then there's a second camera with a wider view. So yeah, hopefully technology, and now we're going to be getting, virtual reality and goggles and just
Hmm.
glasses with a camera, so it just moves with you as you move. We have the what are they called, the Go
The
cameras? I don't know.
GoPros.
GoPros, like move around with you. So yeah, hopefully things will evolve there. But like you said, then the materials. Another benefit I heard of is that you get to see the client in their environment, in their interactions with their family, in their own space. So you get maybe get a sense of what's working with that space with the client, what's
Hmm.
not, um, and what maybe is helpful, what triggers are there, etc. Can you speak to that? What's that been like to be able to see the client's environment?
Yeah. So with ABA, we actually provide services in multiple locations. So we don't only provide services in our clinics, but we also provide services in schools, in homes. Of course, when the pandemic, we had higher case numbers and we were attempting to do telehealth more. It definitely allowed us that space to see more of the natural environment of what takes place within the home and what those dynamics might be. And even outside of that, we do provide services in the home and in school. So we're able to see a lot of those natural environments that our clients are in and how their behaviors and their abilities might, and especially their communication, might look different in each of those environments.
Yeah. And do you coach the caregivers, the parents at all? And if you do that, do you do the technique of like the bug in the ear, where the parent or caregiver can hear the therapist, so the therapist can give guidance to the caregiver? Is that something that you all do with behavioral
We have
analysis?
no.
Okay. All right.
No, that's not something that we do, but we do provide parent caregiver training. So that is
Okay.
part of the services that we provide, and that is a huge part of what we do is to provide that caregiver training because we want caregivers to have the resources and the tools that they need to be able to continue to work on what we're working on in therapy, whether it's in the clinic or in the home or in the school. Outside of that, and also, we want them to feel empowered that they have the tools and the resources in order to implement those things outside of therapy sessions.
Mhm. Yeah. So it sounds like that the providing services virtually, working directly with clients, there's some challenges.
Mhm.
Um, have there been things that you've done to overcome some of that challenge in terms of, say, the client not struggling with paying attention or sitting still? Are there things that you've guys done via telehealth that's kind of helped overcome that challenge?
So it's a little bit of a hard question to answer because it's so specific to each patient that we work with in terms of how we can redirect their attention, get them back on task with what we're working on. And when it comes to things like that, it's been where parents and caregivers have been a huge part of the session in terms of being more present in that telehealth session to help with redirecting and help with getting clients back on task with what we're working on. And then I guess this also kind of goes back to assessing which patients telehealth is more appropriate for versus patients that would benefit more from in-person therapy sessions, because that's a really big factor also in terms of telehealth, is making sure that it is productive and beneficial for the patient. And if we do see that it is maybe not as productive or beneficial as we'd hope, then we want to make those changes so that we can continue to provide services in a safe way that is more beneficial to the patient, so that they're really getting the outcomes that we're looking for.
Yeah, that makes sense. Yeah, definitely client focused, like client specific, what works for them. And then what about working with the parent caregiver training that you do? How has that worked via telehealth?
So that tends to be really different.
Mhm.
And I think what we found is that it has created a lot of flexibility for parents and caregivers who maybe have a more difficult time to leave work or stop whatever they're doing and be able to attend a session. It's created that flexibility of just being able to, jump on through a secured portal and be able to have their session and have their parent caregiver training in that way. So I think that has been really helpful to a lot of families to continue to access that support.
Have you seen more engagement with the parents and guardians, or like showing up more, being a part of those things more, making use of those services more with telehealth, or not?
I wouldn't say that it's been more versus in person. I think it's just created an area where um, when it's possible, because of course sometimes third party funders like insurances don't always allow for that to take place, but when that is a possibility, we've seen that it creates that flexibility for parents to be able to choose, parents and caregivers, what works best for them. Is it that in person, or is it a telehealth type of service where they can continue again to access that service and what works best for their schedule?
Hmm. Excellent. Yeah. Yeah, and you also work in marriage and family therapy, right?
Um,
Well, you're on the directors and leadership team for the
yes.
American Family Therapy Academy,
Hmm.
AFTA. So it's not necessarily the work that you do, is that right? But
Correct.
you're on the right director
Hmm.
leadership
Right.
team. So maybe you can tell us a little bit about AFTA. Like, what's the mission and vision of AFTA? How are they?
Yeah. So the mission and vision of AFTA is really for family practices and services to be accessible to a wider range of people in a just and equitable way. And we have really, over the last few years, really been working on adaptability and flexibility as an organization, and really looking at how we can promote systemic change and recognizing that systemic change starts from within the organization.
Okay. Yeah. And in terms of, and what change are they looking for?
Um, so we're looking for family therapy practices to be more accessible to people all around the world, more accessible and more equitable. So for people to be able to access services at all different levels. Telehealth is something that has really allowed for that to start happening, because people who maybe didn't have services close to them, or for whatever reason were not able to access therapy services, are able to do so via an online type of format and still have access to the services that they need.
Yeah. And do you know what some of the what some of the challenges have been in terms of people being able to get access to marriage and family therapy?
Um, So really what some of the things could be are things like the cost of services, coverage. So if whether or not your insurer covers services for you, it could also be just where you're located. So
Mhm.
depending on where your location is, you might not have access to a marriage and family therapist nearby.
Right, right. Yeah, I definitely have seen that, and most people have. There's certainly a shortage, and might be able to find a therapist, but not someone that's a marriage and family therapist, which, yeah, families
Hmm.
really, really benefit from. So I can see how telehealth would really broaden access to providers that might not be in your area or that actually have availability. So
Hmm.
that's really helpful. So one thing that I really love about organizations like AFTA is they're usually helping clinicians, whether or not they know it or are a member. So can you tell us a little bit about the benefits of a marriage and family therapist being a member of AFTA?
Hmm. Yeah. So one of the things that I guess I want to start out with is that as an organization, our board and our leadership team is really looking to continually continuously find opportunities to engage our members and provide more benefits to our members. Um, so our members are able to receive discounts to our annual meeting and open conference. We also have a webinar series that we launched last year, which is free to members. And we host them throughout the year. There are different presenters. We try and do about one a month. Members are also able to join interest groups. We have multiple committees that members are also able to join. We have publications, the Springer Briefs, that members have access to. And um, we also provide a member and therapist profile. So this way, members can be searched based on the type of therapy that they provide and anything else that they might be putting into their profile.
Excellent. Yeah. So if you're a marriage and family therapist, you want to get to know other marriage and family therapists throughout the country, and also receive great training and opportunities, resources, staying informed and on top of your field, and another directory that's specific for marriage and family therapists. Yeah, AFTA would be a great place to go for that.
Hmm. Absolutely.
Yeah. So, Dr. Dominguez, thank you very much. This has been very helpful. It's good to hear from your experience working as a behavioral analyst. How the transition to virtual work has been for you, the challenges, the adjustments that you've had to make, the fact that you have to consider what's working best for the client and
Hmm.
pivoting to their needs, because for some it sounds like it creates greater access, which is really important, whereas for others it doesn't work so well, and seeing a clinician on site is a better fit. So yeah, that was very helpful. Really appreciate all of your information.
Thank you very much for having me.